thank you guys very much for being here. I know you didn't come here to hear me talk, so I'm just going to very quickly give you a couple of updates about what's going on with the chapter. You know, as I was preparing my slides, it is, the president of the chapter is largely a ceremonial position, which is just my kind of work because it means I don't have to do anything hard. But Bo mentioned the folks that work to get events like this going, and there's a massive number of people that are actually involved, many of them in the hallway, John and Joanne in the back of the room, always taking care of the video pieces. And then the board of directors is just these are folks that have 2 or 3 lives already. Work lives, professional lives, personal lives, and yet they find time to volunteer to put events like this together. There isn't a single dollar of compensation for anybody that's associated with any of the HIMSS chapters by law that's written into our bylaws. So it really is a terrific group of people. Also want to thank all of you. It's not easy for you to take a day. The work doesn't get the day off, even though you decide to come and spend some time listening to some terrific speakers. So thank you for doing that. Want to thank our friends at Hogue. What a beautiful facility and what a beautiful location. I know I probably am not the only one this morning as I was driving here saying, do I really want to make that right turn onto Hospital Road or just keep going because I can see the beach, I can smell the beach, and it's such a nice day. My oldest son, Joshua, is posted at Fort Drum in the Army in upstate New York, and I'm getting these wonderful pictures of he and my daughter-in-law, my granddaughter, building their first snowman, and I'm on the back deck in shorts, contemplating whether I need socks today. So we're pretty lucky to live in this area. I won't introduce all the board members, but it's a wonderful group of people. Many of them are here today. You will find them walking around and introducing themselves, and I hope that you'll spend a couple of minutes and chat with them as well. The folks that do the real work in terms of this event, the planning committee, we have an exceptional team of people led by Jerry Pavia, who is our Vice President of Programs, and then each of our major events have a specific group of people that are assigned to an event, and there are many more that have worked on this, but here's just a short list of those that were most involved. These folks are also strategically located throughout the venue this morning, and will likely, you'll see them, and I hope you'll thank them as well. And last but by no means least is our sponsors. Events like this we really cannot do without having the sponsor support. So I hope you'll take time during the breaks today and go by and say hello, make the rounds with them. They're right across the hall. By design, we put things like coffee and soon to be arriving juice there, so you are a captive audience when you go into that room for a few minutes. But drop by, say hello, and have a chat with them. We'd really appreciate it. And just a couple of other things. All of this is on our website, which is down at the bottom of the slide there. We've got, we'll take a little break here through the holidays after this event, and then we've got our joint networking event, which is in its 3rd or 4th year, I believe, that will be occurring on Tuesday, February 25th, for those of you attending the national conference in beautiful Orlando, Florida. This time around. The annual Healthcare IT Conference coming up in April, and then CIS, the Clinical Informatics Summit, which is one of our most popular programs. Haven't firmed the date or the location yet on that one, so we do know it's going to be in May of next year, but it's one of our big events. If you're going to attend that event, my advice is arrive 20 minutes late, because I have to do a state of the chapter update, and it'll be really, really boring, and you won't want to hear me. So get out of bed 20 minutes later and attend that event. So it is my extreme pleasure to introduce Dr. Fernando Martinez, who's the Senior Vice President, Chief Information Officer of Parkland Hospital, who's been gracious enough to agree and come to speak with us today about a variety of matters. So without any delay, let me introduce Fernando to the podium.